If you're like me, then you love finding amazing deals on high quality goods. That's why I love Quince. Quince is all about luxury that's actually affordable. I'm talking 100% Mongolian cashmere sweaters from just $50. Gorgeous washable silk tops and dresses, cozy organic cotton sweaters, and even 14 karat gold jewelry. Now, you might be wondering how Quince can offer such incredible prices. Well, they partner directly with top factories, cutting out the middleman and passing those savings right on to you. And they're not just about great prices, but also about doing things right. Every factory they work with is committed to safe, ethical, and responsible manufacturing practices. And let me tell you about my latest find from Quince. A beautiful navy blue leather tote bag. And this bag isn't just gorgeous, it's super sturdy, holds everything I need, even my laptop, and is stylish on top of that. So if you're looking for top-notch quality without the high-end price tag, you really should check out Quince. Give yourself the luxury you deserve with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to another Mo's Monday Minute, my little short episodes to help you improve your practice as a nurse or a nursing student. Hopefully something that you can start applying right away. And today I want to talk to you very briefly about this concept of things not making sense. So I see this a lot with new students, new nurses. I saw it in myself as a new nurse, and I utilize this practice regularly because, hey, often things don't make sense. And when something doesn't make sense, and we'll talk about what I mean by that in just a moment, the absolute worst thing that you can do is just go, that's weird, and then move on. If something doesn't make sense, I want you to apply your critical thinking skills, apply that curious part of your brain, and dig deeper. So one way where something might not make sense is a vital sign that you obtain that just, hey, does not make sense. So for example, let's say I've got a patient who is awake, they're talking to me, they're mentating just fine, they have no complaints of dizziness or any problems, and I take their blood pressure and the reading is like 77/43. Does that reading make sense? No, it does not make sense. Now, I'm not going to ignore it, first off, because I would never ignore blood pressure that low, but I'm probably not going to go and aggressively treat it either because it doesn't make sense. Does this patient really need norepinephrine or phenylephrine? Maybe not. So what I want you to start thinking about is, let's say you get a vital sign that doesn't make sense, like a really low blood pressure. What are you going to do? You're going to think, well, that doesn't make sense. I need to investigate further. Okay, think about being a nurse, like always constantly being on like a fact-finding mission. If you love mysteries and solving puzzles, then you are totally cut out for being a nurse. So you're going to investigate further. You're going to check that the cuff is on properly. Maybe it's gotten all twisted around or fallen down under their forearm where it's way too big. Or, hey, speaking of being too big, maybe the cuff is just way too giant for the patient or not applied properly, so it's far too loose. Maybe it's not even on the patient and it was reading the blood pressure of the bed. I mean, I've had that happen. I don't know how it gets any reading, but whatever. The short version of that is, if you get a vital sign that doesn't make sense, reassess and check it again. Okay. And then the same can be said for lab results. That's another area where things might not really make sense. So for example, let's say you have a patient who does not have diabetes and has not received any corticosteroids, and you take their blood sugar and it's really high. Does that make sense? No. So I probably would check it again. I mean, of course, stress, infection, things like that can cause blood sugar to go up, but I'm not going to let just one abnormal reading dictate this patient's whole course of treatment. I'm going to check it again. Okay. I could say the same thing for some other lab results. Let's say your patient has a very low potassium level, or rather, let's say a very high potassium level on their lab draw, and it doesn't make sense, or elevated lactate level on their lab draw, and it doesn't make sense because they don't have any signs of infection. And even though there are lots of reasons for an elevated lactate that aren't infection, let's say they don't have any of those either. So an elevated potassium and an elevated lactate specifically can occur if the phlebotomist left the tourniquet on the arm too long. And, maybe it took a long time for them to do the draw. And by the time they do it, they've damaged some cells, which have released some potassium right into the vascular space. So your potassium level is going to read extra high. So again, if I got a lab result like that and it didn't make sense, let's say the potassium comes back as critical and the patient's having no signs or symptoms, their EKG is perfect, I'm going to think, doesn't really make sense. I'm going to get a redraw on that. So that is my Mo's Monday Minute tip for today. Always be thinking that you're not going to take every result, every vital sign, every lab at face value. You've got to think about, do these results make sense? And if they don't, put on your thinking cap and investigate further. I will see you again very soon, and hopefully you're enjoying these Mo's Monday Minutes just as much as I am. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wished that you had a direct line to your pediatrician to ask all the questions that constantly crop up while parenting? We sure have. That's why we launched the Bites of Health podcast. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. You can tune in while you're making your second cup of coffee or from the school drop-off line. So be sure to tune in to Bites of Health, streaming now.